lecture so late in the night. So this is awesome. Um, so, when you go to a cocktail party and people talk to you about, they find out what you do, you don't really like to tell them, and they're like, "Oh, so you euthanize horses, right? Because you do orthopedics and horses," and they first think you're doing orthodontics, which is then you have to kind of correct it. But no, the what the when you fix racehorses, one thing that clients don't want to make public is that their horse was injured and was fixed, right? So you're always laying in the background, so to speak. So we're going to talk about some of the common things that happen in racehorses and what can be repaired, mostly hopefully to go back to full athletic performance, and then some of the things we do for what we call salvage. And in our opinion, what that means is breeding soundness or being able to be turned out without medications or maybe at a lower level of activity. So the orthopedic racing injuries, right? They're high energy, right? They're dramatic, they're public, right? So we have this possible human injuries, and they're scrutinized in the papers and elsewhere. So we have to be, the best we can do is really better for our industry, right? And so good success stories, and even some stories that aren't successful, like Barbaro, at least it at least heightened how difficult this problem is, and people are certainly empathetic for it. So we understand that in our industry, and we understand that in our practice. And try to do our best in that way. Now, mild injuries, right? What we call mild stable injuries. So when you crack a bone, it's a hairline, or even if you crack it and it moves apart or displaces, as long as there's two pieces and you can put them back together and get interfragmentary compression with screws. So now you've reconstructed the bone, and the bone is sharing the load with the implants without any defects, right? Usually those horses will go back to full athletic performance. The limiting factor for them is going to be what happened to the cartilage, right? So if you have a hairline, the cartilage isn't injured. But I mean, I need the laser for that guy. Anyway, the cartilage isn't injured per se in general. But if you have it displaced, then you may have a wedge of cartilage that may have to be removed, and that would affect the long-term athletic function. But like in these circumstances, a split P1 here, a condylar fracture, lateral condylar fracture of the cannon bone, and here a displaced slab fracture. In general, these horses return to full athletic activity. If they do have, especially the slab fractures, if we have some cartilage injury at the top here, that's going to affect our long-term prognosis. Okay, but in general, you can expect these horses to return. But then we get some other more serious injuries that we have to repair for salvage, let's say for breeding to broodmare or stallion, or sometimes people will fix horses just to have them, right? So geldings even get repaired based on the client's wishes. But if they're closed, meaning that the skin isn't open, if we can stabilize the patient, transport them safely, do a planned procedure, stabilize them for anesthesia, and repair them with stable fixation, meaning once we get them stable, they get comfortable, and we get comfortable, we don't get laminitis and some of these other things. And so that is comfort is the equal success in general. And then obviously manage any comorbidities that may exist. But one of the really big things that's happened over the past 30 or 40 years is improved anesthetic management, okay, and improved imaging. So you get used to anesthetizing horses, but we never have a cavalier attitude about it, right? Horses, fortunately, don't have a lot of comorbidities, at least in orthopedic patients, right? They don't have diabetes, they don't have heart disease, things of this nature that we have to deal with, or someone has to deal with in people, not me being as slim as I am. But we also have improved imaging, and so this is Debbie was talking about the new CT building. This is what's called a body tom. This is the CT unit. The spokes models do not come with it, but the advantage of the CT is it gives you this three-dimensional image of this fracture from last week, and you can see the split P1, and then you have three-dimensional reconstruction, and then as we look at it transversely, we can see the fracture here, and this is the post-op repair on that. Charlie, I'm the last one, so you're good. I'm just going to keep going. And then what have we learned about management of orthopedic injury in the horses? Most cases can wait. We don't rush in. If a horse gets injured in the morning, we don't necessarily do it that day. It kind of depends on what's going on. Are they hydrated? Are they relaxed? Especially if they have really severe injuries, if we can stabilize them by splinting, they're usually better to have 12 to 24 hours to realize they're injured. Okay, and then the horses are a lot smarter than we give them credit for, or at least some people do. So rehydrate and relax gives us a chance to plan, give us a chance to relax, give all the connections a chance to relax, and the horse adapts to its condition. Okay, here's a split P1. In this particular horse, you can see a very mild line here. So it's been great to do a CT on this post-op. But how can they do this? This is that same horse winning grade 1 stake about 2 years later. Okay. Here are some common fractures. The condylar fracture fixed with screws. We could expect most of these horses to go back to complete athletic use, but when they displace, like here, you can see how this is further apart and has some fragmentation up here. This doesn't matter, but this matters, and this is what it looks like at surgery. So now when we have they're displaced, we have to reconstruct it perfectly. So we do an arthroscopic procedure at the same time so we can line stuff up. And then this is a reduction. You can see the difference between the two pictures, and here's the repair. Okay, and if we looked at these type of fractures, this is a study out of our practice, that if you looked at, this is all different types of fractures, but in general, the bad ones down here that have a fragment and are displaced, 50% of those horses raced, and the ones that were just hairlines, 74% of the horses raced post-operatively, okay? Here's the same, this is a condylar fracture as well, but this one's on the inside of the bone. It's called a medial condylar fracture, and they go up and they either spiral or they go and they form a Y, and they're much more serious, so we have to plate them. So there's a big risk of the horse completely breaking its leg. So we fix them with this, the 2 screws like you saw before, and then a plate to neutralize the forces. And this is the post-op views. This is about 4 months later when we took the plate out. You can see the scar of the fracture here going up. Okay, and this is this horse last year. So this is 4 years after taking the plate out. This same horse. Now he doesn't have his plate. It's this leg. You see, we still have a bandage on it because it's draining. No. So that's that horse winning. Carpal injuries. You should expect most of these horses can race again. These are different slab fractures or through the third carpal bone. It all depends what's going on at the cartilage, though, as far as their long-term prognosis. Here's an additional one with its multi-piece, and sometimes we got to put screws in a couple different planes. These are the most severe ones. This is the Ruffian injury or the breakdown injury. So back in '76, for those of us, there's few of us in this room that remember that race against Foolish Pleasure, and Ruffian was champion filly, and Foolish Pleasure was champion male, and they had a match race. They don't have match races anymore at Belmont because of this, and she broke down and was managed just with a cast. And this is a procedure Dr. Bramlage developed called the Fetlock Arthrodesis, and this is a horse that was worth 1/100th of what Ruffian was worth, right? This particular horse, standard-bred stallion, had the same injury, and this is how we fix them now. I didn't put those white spots in them. That's from a freeze firing. But anyway, it's a very successful. About 70% of those horses with that severe injury can be salvaged as breeding stock. And you can see the protective shoe here. Dr. Lesser was talking about preventing laminitis, and this is like a 6-week post-op on this particular horse, and can become a breeding stallion at that point. I'll end on this particular horse. This is a horse that was training at Churchill in the morning, came over one Saturday afternoon after this injury, and you can see it has this condylar fracture that we saw before, but this one's has a little bit extra going on, right? We got a spiraling fracture up here. We have additional separate pieces. Okay, so we're going to need to do multiple things. It's kind of going to take everything we do. We have to open up. I don't even know what all this stuff is, right? But I just open it. And so here are the plates. Here are the screws. This is the orthopedic equipment. This is our staff. We have someone else doing anesthesia, and our technician you don't see in the room right now, or she's in the room, or he is, but you don't see him in the picture. Getting prepped to go ahead and repair this. The first thing we're going to do is reduce the fracture that you saw arthroscopically. So we reduce the articular surface, okay? And this is this particular horse. This is the front of the joint, and this is after it's reduced. Oops, sorry, I keep hitting like Larry did. The advance and the pointer. And then this is the back of the joints reduced. But the big thing that happens with these guys is they tend to shear the cartilage off their sesamoid, and that often prevents them from going back to racing. Okay, but we were still salvaging this horse regardless. This is the interop image, and you can see how that mimics this. Okay, and then once we fix that fracture, the easy part, if you will, which is not really that easy, that's through those incisions. Then we open up the joint. You can see open up the cannon bone. You can see the large fragment right here, this butterfly, and then the additional lines going up. And this is the neutralization plate that's placed on there. This is the post-operative appearance, and then this is the post-operative radiographs, and then this is this particular guy. I should be playing, but oh well. You're supposed to play on, why don't you click it there? Thank you. So, they have to stand and get back to their stall, and this is 18 hours post-op. He's about 200 feet from the surgery room. He's in barn 2. And, you're not going to take him out and jog him today, folks, but, we're pretty happy. And he's just on phenylbutazone, by the way. as an analgesic. So, and he went on to heal well. They did not race him again, mostly because of the cartilage injury, but wanted to save his life, which was really cool. So anyway, I'm sorry I went over, Sterling, but thank you very much. So I think that's it. And Dr. Riddle's going to come up, I think, or Dr. Spike Pierce, sorry.